Hi everyone, welcome to my presentation. Now I tell you the topic signs and symptoms of lithium toxicity. So before that, what is lithium? So lithium is a most stabilizer commonly used for acute mania, bipolar or unipolar mood disorder, schizoaffective disorder, cyclothymia, impulsivity and aggression, for bulimia nervosa, trichotillomania, for cluster headache, episodes of binge drinking. So these are all the indications for this lithium drug. So when we say lithium toxicity, if serum lithium level, here you can say serum lithium level above 2.0 milliequivalent per liter. The serum lithium level above 2.0 milliequivalent per liter. So that the situation you can say lithium toxicity. So what are the signs and symptoms we can see at this time? The first one is ataxia. Ataxia is nothing but it is a neurodegenerative symptom characterized by severe disability. The next, coarse tremor. So in bracket also they mention hand. Coarse tremor is nothing but it is also, one type of tremor characterized by low frequency movements of hands or low movements of. Okay. Then next, nausea and vomiting, impaired memory or memory loss, impaired concentration, nephrotoxicity or renal injury, muscle weakness, convulsions, muscle twitching, dysarthria. Dysarthria is a speech disorder caused by muscle weakness which is needed for speech. Speech disorder caused by muscle weakness which is needed for speech. Then lethargy, lack of energy. Then confusion, coma, hyperreflexia. Hyperreflexia is nothing but overactive or over-responsive bodily reflexes or body reflexes. Over-responsive body reflexes, overactive body reflexes called hyperreflexia. Then last, nystagmus. Nystagmus is nothing but rapid or uncontrollable eye movements. Rapid or uncontrollable eye movements called nystagmus. So these are all the symptoms you can see in the patient who has this lithium toxicity. Already I said, so when we say the lithium toxicity, when the serum lithium level above 2.0 milliequivalent per liter, so at that time we can say lithium toxicity. So these are the symptoms. So what are the symptoms? Ataxia, coarse tremor, nausea and vomiting, impaired memory, impaired concentration, nephrotoxicity, muscle weakness, convulsions, muscle twisting, dysarthria, lethargy, confusion, coma, hyperreflexia, nystagmus. Then what is the management for that? What is the management of this lithium toxicity? First, what we have to do? So as a health taker, when we found that the patient has lithium toxicity, as soon as possible, discontinue the drug immediately. So this is the first one. Then the next, short-term injections, residual gastric contents should be removed by induction of vomiting, gastric lavage and absorption with activated charcoal. So this is the second step. Then next, if possible, instruct the patient to inject fluids. Then assess serum lithium levels, serum electrolyte, renal function, ECG as soon as possible. Then maintenance of fluid and electrolyte balance is essential. If the patient has serious clinical manifestation because of this lithium toxicity, So what we have to do? Send the patient for hemodialysis. What we have to do? First, we have to discontinue the drug immediately. And not only that, short-term injections, gastric contents should be removed, and induction of vomiting, gastric ravis have to do. Then absorption with activated charcoal. Then, if possible, instruct the patient to inject fluid. Assess serum electrolyte, renal function, ECG as soon as possible. Maintain electrolyte and fluid and electrolyte balance. And if the patient has serious side effects, then send the patient to hemodialysis. So this is about the lithium toxicity, and its signs and symptoms and management. In the next class, I tell you contraindications of lithium use and role of a nurse for a patient receiving lithium. Thank you.